Okay, so we're going to begin looking at the conditions related to the respiratory condition. Now, as I said in class, beyond what I talk about here, make sure you go through, review all the signs and symptoms and treatments for each one of these conditions, and also make sure you take a look at, if they talk at all about, they do this many times in the readings, they talk about differential diagnoses. So look at that as well, because that's kind of relevant, really relevant to what we're discussing in class as it relates to being able to kind of narrow down conditions when we do assessments of general medical conditions. So any type of differential diagnoses, pay attention to bolded words, or if there's other conditions that they talk about that you need to make sure you kind of narrow down when you're looking at these different conditions. So we'll start out talking about asthma. So asthma is a pulmonary disorder that basically results from a hyperreactive response in the airway. And you hear the term, a lot of times they call them twitchy airways. And the two components, and this is important as it relates to asthma when we talk about some other conditions, there's two components. There is inflammation, and then there's spasm of the airway. So those are the two things that end up leading to the obstruction and the breathing difficulty. And more so with people with asthma, a lot of the problem is breathing out, not so much being able to breathe in. So it's the expiration that gets to be difficult for the individual. And there are common triggers associated with asthma. So things like, allergens can do this, can cause asthma attacks. Stress and anxiety can cause asthma attacks. Environmental pollutants, smoke, cold temperatures. Okay, cold, dry temperatures are usually a big time trigger for most people with asthma. Okay, so when the air tends to be warmer and more humid, you tend to see fewer asthma attacks. And exercise itself is also a trigger. We're actually going to talk about exercise-induced bronchospasm, and many times people who have asthma have both asthma and exercise-induced asthma, and we'll talk about what the difference between those two will be. Okay, so we have exercise-induced bronchospasm. Now, your text begins talking about exercise-induced bronchospasm and talking about how exercise-induced bronchospasm and exercise-induced asthma are terms that get used interchangeably. They actually are two different things, and I sort of hinted at this a little bit in my discussion of exercise-induced asthma. So first talking about this. So exercise-induced bronchospasm is when you have bronchospasm and decreased pulmonary function following exercise. Okay, so what tends to happen here is that the individuals will exercise, and we'll talk about what physiologically causes this, but the bronchi go into spasm, and then they end up having lack of ability to use the respiratory system. Now, the difference between exercise-induced bronchospasm and exercise-induced asthma. So remember, with asthma, we said there's two components. There's spasm, and then there's the inflammation, okay? When someone strictly just has exercise-induced bronchospasm, it's essentially it's just strictly the bronchospasm that occurs as a result of exercise. They don't have the inflammatory component of the asthma. It's just strictly the bronchospasm. So that's really the difference between the two. And you'll still hear people use the two things interchangeably. The symptoms usually occur 10 to 15 minutes after the onset of exercises. And what you see here is when the way they test for this is through spirometry, okay, through exercise spirometry, where they test the individual's forced expiratory volume after exercise to see if they do indeed have this. And there's a flow chart, which actually I'm going to show here, and it's in your text, that shows how we do this. You see this more common in winter sport athletes, particularly those who compete in cold temperatures. So with this condition, that's really what they look at as kind of being the source of the exercise-induced bronchospasm is the decreased air temperature, and particularly when the air is dry. So what ends up happening is there ends up being this issue where through either a temperature or change in humidity, where the airway basically ends up getting engorged with blood and getting swollen from that, and that's where the spasm essentially comes from. That's as opposed to with asthma, where there's an actual inflammatory component that causes the airway to get inflamed and go into spasm as well. So again, as I said, this is in your book, but take a look at this. You can see what they do as far as if they're worried about somebody having exercise-induced bronchospasm. They do the spirometry test, and what they look to do is see whether the results are normal or abnormal. If the results are abnormal, they confirm that they have exercise-induced bronchospasm. And then there's different types of treatments. They consider the different types of treatments based upon patient preference and what have you. Again, as you're going through all of this, make sure you're noting the treatments and management of this. If the results are normal, they try some other things, maybe even going as far as trying an inhaler prior to a competition or prior to a game, prior to some sort of physical activity, just to see if their symptoms do get relief. Okay, so obviously if the results are normal, they still have to try to find another cause for the condition. There are some other conditions that do kind of mimic exercise-induced bronchospasm. One of those conditions, and your textbook does actually highlight this, and I'm going to point this out, is something called exercise-induced laryngeal obstruction. What basically happens, it's a vocal cord dysfunction that occurs and causes obstruction of the airway and seems to be very similar to asthma. So many times, they tend to think that the patient may have asthma, and it turns out that they actually have this vocal cord dysfunction that actually causes difficulty with exercises and impairs their breathing. But take a look at this. There's also some different, and this is something, since we encounter it quite a bit, look at some of the things, and we'll do some stuff with this in class. Look at the return to play and everything with this as we look towards how to kind of manage this with the athlete. Okay, so looking at another condition, bronchitis refers to an inflammatory condition of the bronchial passages. So if you remember going back to our anatomy, the upper versus the lower airway, the bronchi are in the lower airway. They lead to the alveoli where the gas exchange takes place. There's different types of bronchitis. It can present as either acute or chronic. Many times acute bronchitis occurs from a viral infection. Okay, so when we look at infections, there's different types of infections. Now, bronchitis can occur from viral infections. It can also occur due to bacterial infections as well. Now, obviously, whether it's viral or bacterial will kind of dictate some of the treatment. There's obviously, for bacterial infections, they can be treated with antibiotics. Viral infections, antibiotics are ineffective for. So again, the essentially happens here depending upon the cause, and sometimes the signs and symptoms will kind of allow you to differentiate what the actual cause is. You also have to look at your differential diagnosis. Sometimes this can be confused a lot of times with pneumonia. So kind of look at what the differences would be there between bronchitis versus pneumonia. A chronic obstructive pulmonary disease, or COPD. So this is a non-reversible airway obstruction. Probably won't see this in a lot of young people, obviously, but this is something that can occur. It's usually found in long-term smokers. But again, individuals who have respiratory issues throughout life could potentially end up with this as well. It's mainly divided. So there's two categories of conditions that kind of make up chronic obstructive pulmonary disease. One of them is emphysema, and the other is chronic bronchitis. So looking at those two, since they're the two kind of primary things we look at with COPD, emphysema is when you have destruction of the alveoli and the pulmonary capillary bed. So again, going back to our previous anatomy discussion, if you look at that, again, we said the alveoli is where the carbon dioxide oxygen exchange takes place in the lungs. With emphysema, that alveoli essentially gets destroyed and doesn't become functional. So you kind of have, this sort of increased area of the lungs where now you can't exchange gases, which obviously is going to cause breathing difficulties for the individual. The other manifestation of this is chronic bronchitis. So basically what essentially happens is now with the airway, you end up getting excessive mucus production, and that ends up causing an upper airway obstruction from all of the mucus that's getting excessively produced in the bronchi. So this ends up causing a lot of difficulty with breathing for the individual once they develop this chronic bronchitis. Okay, pneumonia is an inflammation of the lung parenchyma, so it's the lung tissue actually becomes inflamed. Again, similar to bronchitis, it has different causes. So, part of the thing that we look for when we look at dealing with pneumonia is trying to determine what's the actual cause of it. The more common forms are the viral or bacterial forms. Fungal infections typically don't happen in healthy individuals. Many times fungal infections occur as a result of someone who is immunocompromised, or for some reason their immune system isn't functioning well. So typically if they're being treated for another condition where maybe they're doing a treatment that suppresses their immune system, that's the type of person you might see a fungal infection in, but it's rare to see that in someone with a normal functioning immune system. So you can see that in that type of individual. But again, a lot of the conditions that we're talking about here, like pneumonia and bronchitis, again, very similar signs and symptoms. So, kind of look at what are some of the other things that you commonly see with this. Again, this will usually be caused by some type of viral or bacterial condition. And again, note the other signs and symptoms, because they can kind of sometimes give clues as to whether or not a person actually has pneumonia. Now, the other thing as well is paying attention to the treatment. So again, if we have a bacterial infection with the pneumonia, we'll be treating that with antibiotics, okay, and then treating any other types of symptoms that the individual may present with. Pleurisy is a descriptive term used for any type of inflammation of the pleura, which is the lining of the lungs, that causes pain. So if the lining of the lungs gets inflamed, and again, usually there's typically another condition associated with this. So pleurisy is a condition, but many times you have to find out, well, what's causing the pleurisy? Okay, so many times pneumonia causes pleurisy. Okay, or some other conditions that we talk about, like for instance tuberculosis, can also cause pleurisy. But anytime that pleural lining gets inflamed, that's essentially what you have. So they commonly occurs with other conditions. You also have to figure out possibly other conditions, some of which we're not talking about. So different types of rheumatic disorders, any type of chest trauma can actually cause this. So this could be something that you see. Obviously, if you're covering athletics in a traditional athletic training setting, chest trauma can cause this. So anytime someone takes a blow to the thoracic region, you could end up having the individual develop a cause of pleurisy. And again, you could possibly put this into a differential diagnosis based on some of the kind of the hallmark signs and symptoms that you would see when you do some of your assessment through auscultation and percussion and what have you. Okay, influenza, it's a very common viral infection, most commonly during the fall and winter months. So there's many times you'll see, maybe small outbreaks of influenza with even sports teams in the fall and winter month. It's always a good idea. The individuals who are most susceptible kind of watch this, because a lot of complications can occur with influenza because of essentially what ends up happening with the body. So obviously with older individuals, people who live in close quarters, this all becomes the increased susceptibility to severe complications. So most of us know of what are common signs and symptoms associated with influenza. So this is probably something that even without discussing in depth, you probably know. But again, just kind of know, again, it's a viral infection. So if it's a viral infection, it can't be treated with antibiotics. There are antiviral medications that are used to treat it. But the thing with the antiviral meds in treating influenza is that many times they have to be taken very early on. So if they're not started early in the process, they're not as beneficial for the individual, because usually what the antiviral medications do is they usually just take a few days off of the illness. Pretty much, they usually shorten it by about a day, maybe two, but typically about a day or two, as far as lessening the severity of the disease. Obviously, there's flu vaccines. They commonly find what the most common strain of the flu that's going to be around and treat it for. If you get a vaccine, you can still technically get the flu, because you can get another variation of the flu. Again, the flu is caused by different viral strains throughout the year, and sometimes it changes. Even if you do get the flu and you are vaccinated, it also means that even if it's a different type, which that can happen, your symptoms will be less severe, and you'll tend to get over it a little quicker. You tend to get over it a little faster. So this is just a picture kind of showing inflammation caused by influenza. This is actually also representative of what you would also see with asthma as well. So while this says it's influenza causing the inflammation here, this is also a very common representation of what asthma does as well. So if you see here, again, there's your bronchioles. So those are the branches that come off of the primary bronchi. You can actually see on this picture the alveoli at the end of the one bronchiole there. But what it's showing you is a slice and kind of depicting what goes on with inflammation of the airway. So with inflammation of the airway gets kind of swollen. There's increased fluid within the interstitial space of the bronchi, and then you get the increased production of mucus, which will then cause the airway obstruction. And again, this could happen with influenza, but this is also representative of what happens with asthma as well. Okay, very common thing to see, and again, especially during particular seasons of the year, upper respiratory infections. So this is a diagnosis given to a variety of kind of self-limiting viral infections, and this is something that's going to impact the upper respiratory tract. So pretty much all your symptoms are kind of above the neck, if you will. And it's caused by a virus, the most common virus being the rhinovirus. That's what we refer to as the common cold. There's others out there, and again, the symptoms and the severity of the symptoms you get will be based upon what type of virus it is and kind of how your immune system takes to it. Very highly transmissible, very contagious. It's transmitted via contact with respiratory droplets. So someone coughs or sneezes, and you pick up the droplets from that, and that would typically cause the added symptoms then that you would get. So again, upper respiratory infections, typically there you're looking at your signs and symptoms. Again, variety of as far as the severity goes. But that will depend upon the individual's immune system and how they take to it. Okay, I sort of mentioned tuberculosis earlier on. This is a highly contagious bacterial infection. caused by the mycobacterium tuberculosis. So this is something that will occur within the lungs. And it's gonna occur, transmit it again, much like the common cold, by inhaling droplets when somebody either coughs or sneezes into the air. So what basically ends up happening is you get the formation of granulomas. So what granulomas are, they're basically they're basically like small tumors that develop in the lungs. Now, when I say tumor, a tumor doesn't always infer cancer. They're just kind of masses that develop in the infected tissue. So, and usually the trick with this is many times the individual early on is asymptomatic. So a lot of the earlier, it may not be picked up early on with the infection. So that it could kind of cause the person to kind of overlook it at first. So again, you don't see too much of this in the United States. It does show up from time to time. Very important that when somebody does have it, many times this is again going to be something that many people who have either disorders or do treatments for conditions that suppress their immune system. So people without fully functioning immune systems many times will develop this. Okay, lung cancer. So this is one of the most common cancers in the United States. It's actually one of the leading causes of death from cancer. So when we look at this, lung cancer, it primarily affects smokers. So if people, it's not that only smokers can develop it, but that's primarily who gets affected by this. And there's also increased risk for those exposed to secondhand smoke. So if someone smokes and or they live with someone who smokes, there's a chance of developing this. So the issue with lung cancer is that many times the prognosis is poor, primarily because a lot of times it's not detected until the later stages. Okay, so there's many lung cancers that if they're found early enough, the person could be adequately treated for, could be removed. But the problem is that many times the lung cancer isn't detected until later stages, and then typically that involves spread to other organs. So, what's called metastasis, where the cancer then moves to other parts of the body, and then that's what makes it much more difficult to treat. So it could spread to other organs, it could spread to the bone, it could spread to the brain, and then that's usually where it makes treatment difficulty much more. Okay, a spontaneous pneumothorax. So a pneumothorax is what's referred to as a collapsed lung. So what happens is inside the chest wall, you get gas or air trapped in there, and it gets trapped between the parietal and visceral pleura, causing the lung to collapse. So the lung in order for the lung to basically stay up and functional, there has to be what's called a negative pressure, and that negative pressure keeps the lungs up against the rib cage. That negative pressure gets lost because of air getting in there. It causes the lung to collapse, and it's deemed spontaneous if it's in the absence of traumatic injury to the chest. So you can also have a pneumothorax caused by a trauma to the chest as well, and that would cause the lung to collapse. Okay, but it's only deemed spontaneous if it occurs in the absence of traumatic injury. And many times the primary thing you would see with this, just to mention it along with the condition, is that all of a sudden the individual will have a lot of pleuritic chest pain, so they'll complain of that pleuritic type chest pain along with shortness of breath. So that's what happens with the pneumothorax, and it causes the actual lung to collapse. So now we have a hemothorax. Okay, so a pneumothorax is when air collects in the pleural space. A hemothorax is when blood collects in the pleural space. So now you have a condition where it's not air that's causing the lung collapse, but a buildup of blood. And this will happen particularly when you're looking at injuries in athletics due to some type of trauma to the chest wall. Rib fractures can commonly cause this. So what happens, the rib fracture ends up causing damage to that lining, and then ends up causing some bleeding to occur in the pleural space, and that will cause, again, the lung to collapse because you'll kind of lose that negative pressure. It could also occur due to malignancies. So if someone does have a tumor on the lung, which can cause damage eventually and cause bleeding, that's then where you would end up having the hemothorax develop. So this could also occur in cancer patients as well. So here's kind of a picture if it was difficult to kind of see, and these illustrations are also in your textbook. So here's a picture of a pneumothorax, which again, so pneumo just refers to the gas or air. Okay, again, whether it's spontaneous pneumothorax or not just kind of depends upon if there is an actual trauma to the lung or not. Again, absence of trauma, it's deemed a spontaneous pneumothorax. If by chance it were caused by a trauma, then it's just a pneumothorax. So you see here again, you see the collapsed lung. So if you look at the picture on the left, you see that there's been air that got inside that pleural space, and what that does is causes the lung to collapse. Again, for the lung to stay expanded and up against the chest wall, you need to have that negative pressure. That negative pressure gets lost if air gets in there, and then that causes the lung to collapse. Picture on the right denotes a hemothorax. So the hemothorax, again, this would more commonly happen in a younger, healthier individual due to a trauma. And so if a rib fracture ends up damaging some tissue in that region, you end up getting the bleeding, and then that forms within the space, causing the lung to collapse as well. Now, something you can also get with this, and this picture denotes what's called a tension pneumothorax. Okay, so what happens with a tension pneumothorax is that pressure continues to increase. So if you remember looking at the previous slide, we saw the air getting trapped in there and causing the lung to collapse. If that air continues to build up, eventually what happens is there's only so much space in there for everything. You actually get a shift. Okay, so you get a mediastinal shift. So the mediastinum is the term used for the space in between the lungs. So you see what's in between the lungs. You have the heart and the major blood vessels there. And what eventually happens is that pressure builds up to the point where it actually causes a shift. So if you look at the midline of the body, those very important structures begin to get pressure put on them, and they kind of start getting shifted over to the other side. You could even see the deviation of the trachea on this picture. So this is something that would happen if the air continued to build up in the region. And again, this could happen as a progression of just a regular pneumothorax, or if the trauma that occurred to the individual is pretty significant. This needs to be treated very quickly, obviously because of the pressure on the heart and the great vessels that does end up occurring. So that actually ends the conditions for the respiratory system. Again, be sure to note your signs and symptoms. I did give that chart. You don't have to fill out the chart. You can just put some important notes within the content that I gave you with the slides on them if you want, but I think it could be beneficial for you to do that. And again, pay attention to treatment, return to participation, and any diagnostic tests that are relevant for the treatments. For some of them I did mention them, but still, even for the others, make sure that you note them as well as you're kind of going through the information in the text.